Interstitial cystitis, IC. Positive steps on the road to relief. Brought to you as a service from Alza Pharmaceuticals, a division of Alza Corporation.
It's a very tough disease to live with, let alone try to incorporate a career and a family.
What I wasn't aware of was how much emotional pain it would cause.
I've had interstitial cystitis for 3.5 years.
I was getting up about 8 or 9 times a night and going to the bathroom probably about 3 times an hour.
Always having to be near a bathroom, day and night, suffering with pain, feeling tired, not knowing what's wrong. This frustrating experience is typical of many people, perhaps like you, who after a period of months or even years have been told they have interstitial cystitis, or IC for short. The good news is, now that you've been diagnosed, you're in the position to begin to take control of your condition. This video has been created to provide you with information on the causes, diagnosis, and treatment of IC, and to show you some of the positive steps you can take on the road to relief. 10 years ago, IC was a little-known disease and was often misunderstood, misdiagnosed, and mistreated. But thanks to the efforts of dedicated patient advocates, researchers, and physicians, we've learned a great deal about IC and its treatment. Dr. Grant Mulholland, a urologist in Philadelphia, is one of the leading researchers in the field of IC.
One of the most important theories that's been developed is a theory involving the mucus which lines the bladder, or the gag layer. This particular layer is extremely important as a barrier or a defense in the bladder.
In IC, for reasons that are still not clear, the protective lining of the bladder, called the glycosaminoglycan layer, or the gag layer, becomes thin and defective over time. This exposes the underlying bladder wall to harmful chemicals in the urine, causing the bladder to become tender and inflamed, and symptoms to appear. But a defective gag layer is just one of the several possible causes of IC, and there may be more than one cause. Other possible causes include allergic reactions to your own body or to certain foods.
Probably one of the most bothersome symptoms is frequency of urination in the IC patient. This has tremendous impact on their life both day and night. 2 other important symptoms in the IC patient are urgency and pain. Urgency occurs when the patient has the urge to urinate and has to relieve themselves in a short period of time. Pain is usually pelvic pain, pain in the lower part of the abdomen, pain in the bladder.
In addition to frequency and urgency, some people also experience feelings of pressure and pain in the bladder and/or pelvis, sometimes during intercourse. Symptoms can feel like a urinary tract infection or UTI, even though a urine culture will test negative for UTI. Men with IC may experience discomfort or pain that can mimic prostate disorders. The symptoms of IC vary greatly from person to person. Symptoms may disappear without explanation, or coincide with an event such as a change in diet, or in women, the beginning of a menstrual cycle. Even when symptoms disappear, however, they may return after days, weeks, or months, and no one is sure why. About 450,000 people in the United States are believed to have IC. But the true numbers may be higher because many cases are either undiagnosed or misdiagnosed. Terry Jo Myers, a professional golfer and a champion on the LPGA Tour, and Diane Bishop, a mother of 2 and a former attorney, are 2 people who, like you, have IC.
I've had interstitial cystitis for 13 years. It's been tough. I've had to urinate up to 60 times a day, 15 to 20 times at night. For the first 10 years of this disease, I didn't sleep. If I slept 40 minutes, I felt like that was great.
I know that I've had interstitial cystitis for a year. It was diagnosed last July, and I've had the symptoms probably for at least 2 years without knowing what exactly it was I had. I thought I had had a series of bladder infections and would go in for cultures, and there would be no sign of infection. My gynecologist finally said, "You need to go see a urologist. I think you may have interstitial cystitis."
Although people of any age can be affected, about 2/3 of patients with IC are in their 20s, 30s, or 40s. Most cases of IC are in women, but at least 10% occur in men. Even doctors can get IC.
I've had IC, interstitial cystitis, for 3.5 years. It was rather difficult to diagnose, A, because I was a male, and B, because I was older than the average person that has the onset of it.
Studies have shown that it takes most IC patients years to be correctly diagnosed, and these patients may see several doctors during that period. Dr. Robert Evans, a urologist in North Carolina, has diagnosed more than 300 cases of IC.
I always stress to my patients that the key to the management of interstitial cystitis is having an accurate diagnosis. You've made a very important first step, having been correctly diagnosed. While it's important to realize that this disease is not currently felt to be curable, the symptoms that patients with interstitial cystitis have, such as urgency and frequency, are very controllable.
Because the symptoms of IC are similar to those of other disorders of the urinary system, IC is diagnosed largely by ruling out other causes for your symptoms. Your diagnosis is based on findings such as the absence of other diseases that may cause your symptoms. It's very important to rule out bacterial infections of the bladder, sexually transmitted diseases, vaginal infections, bladder cancer, and in men, prostatitis. The presence of urgency, frequency, or pelvic or bladder pain. And in some cases, your doctor may have used an instrument called a cystoscope to look inside your bladder for evidence of IC. Although there is no cure for IC, treatments are available that help relieve symptoms in some people. Some medications need to be placed directly into your bladder by a doctor or nurse. Doctors can also prescribe Elmiron, pentosan polysulfate sodium. Elmiron is the first oral medication shown to be effective in the long-term management of bladder pain and discomfort associated with IC. You and your doctor should discuss which treatment options are best for you. The protective gag layer of the bladder can become thin and defective over time, exposing the underlying bladder wall to harmful chemicals in the urine. This causes inflammation of the bladder and leads to symptoms. Elmiron is excreted in the urine and is thought to coat the bladder, providing the protective function of the gag layer. Of course, Elmiron does not work for everyone, but for many people, Elmiron holds the promise of providing sustained relief from pain and discomfort. For Elizabeth McIntosh, a medical student in North Carolina, Elmiron has made a big difference.
When my doctor told me that a new drug was being looked at by the FDA, that's when I was introduced to Elmiron. It was the most positive step that had come up to this point since my diagnosis of IC.
I tell patients that they need to commit to taking this medication for between 3 to 6 months before we can jointly make a decision as to whether that's an appropriate drug for them. I tell them that the improvement is slow, but it is real. I do feel that they need to give it that 6-month time frame before they can decide if it's a good long-term therapy for them. I also tell patients that if the drug works for them, that it's likely to continue to work, and there does not appear to be any drop-off in symptom control over time.
Elmiron should be taken 3 times a day, at least 1 hour before meals, or 2 hours after meals, or as advised by your physician. In clinical trials, Elmiron was shown to be well tolerated in most people. However, a small number of people on Elmiron therapy reported side effects. The most common side effects were diarrhea, nausea, mild hair loss, which was reversible upon discontinuation, headache, rash, upset stomach, abdominal pain, liver function abnormalities, and dizziness. Patients should be aware that Elmiron has a weak anticoagulant effect. Please talk with your doctor if you're taking a medication or have a condition that increases your risk of bleeding. When side effects occurred, they were generally mild and usually did not interfere with continuing treatment. Call your doctor if these side effects persist or are bothersome. To keep you motivated as you manage your therapy, especially during the early period until Elmiron can take effect, Alza Pharmaceuticals has developed Turning Point, a free informational program for people taking Elmiron. You can enroll in this free program by calling 1-888-ELMIRON. To learn more about the program, visit the Elmiron website at www.elmiron100.com. Living with IC is a challenge that requires patience and determination. But there are many positive steps you can take to make your IC more manageable.
We work with patients to eliminate factors in their lifestyle that may be contributing to their disease. One of the things that we try to do is to have them improve their diet to eliminate things that might make their symptoms worse. Some of the things that should be eliminated include caffeine, alcohol, foods with high acid contents, or foods that are high in potassium, such as citrus fruits or tomatoes. We also speak with the patients about stress reduction, and we encourage them to join one of the local support groups so that they can interact with other patients with interstitial cystitis and realize that they're not fighting this disease alone.
The Interstitial Cystitis Association, a nationwide organization working to provide IC patients with the most up-to-date information on IC and IC research. You can call the ICA at 1-800-HELP-ICA or visit their website at www.ichthelp.org. By following the advice of their doctors, taking Elmiron, and taking their own positive steps on the road to relief, the patients in this video have taken back control of their lives.
What I say to men is, it isn't the end of your life. It isn't the end of your sex life.
I'm actively involved in horseback riding and a lot of sports, and I consider myself as leading a 100% normal life. And with Elmiron, I'm able to do that. Without it, I was not.
I'm willing to take any steps I can to work on the disease and find whatever way I can to ease it.
I'm making a living. The LPGA Tour is very competitive. It's a wonderful world. It was something I dreamed of since I was a little girl. So nothing was going to take this dream away from me.
Signed what will be her first winning scorecard in a decade of heartbreak.
For more information about IC and Elmiron, ask your doctor. He or she may provide you with an Elmiron patient starter kit, which contains material to help you take the first step in managing IC pain and discomfort. This video has been brought to you by Alza Pharmaceuticals, a division of Alza Corporation. Elmiron is a registered trademark of Baker Norton Pharmaceuticals Incorporated, under license to Alza Corporation. Please see accompanying full prescribing information.